Welcome everyone, and welcome to the e-cigarettes and the youth vaping epidemic webinar, What to Know for 2022. I'm Shelly Klochak, and I am a registered nurse, community education specialist with Spectrum Health Gerber Hospital, and I'm a tobacco treatment specialist up here. And I am one of the volunteers for PAVe that's speaking today, as well as Dr. Shelly Schmidt, who is on the screen, and she is the director of Spectrum Health Pulmonary Fibrosis Care Center, Division of Pulmonary Critical Care and Sleep Medicine, and a clinical assistant professor with Michigan State University College of Human Medicine. I am pleased to start off this webinar today because I am very passionate about e-cigarette and vaping education and advocacy to improve the health of our youth. I am going to speak in three different views today. The first one is as a youth vaping prevention educator perspective. So my partner Caitlin Shucker and I provide e-cigarette vaping education to school teachers and staff and vaping prevention education to youth from elementary through high school. The reason we provide education to school staff is so that they know what to look for. Not only the devices, but the ways that youth can hide these devices and their behavioral changes. It's always surprising on how many teachers and staff are surprised by the different types of devices. And I will often hear that's what that was. Or we'll hear, why do they make it so easy for these kids? The last question is the million-dollar question. And unfortunately, these tobacco companies target our youth and are continuously finding loopholes to provide it legally. So when we are providing prevention education to youth, we are providing facts about these products. There are a lot of myths out there, and we like to clarify those. So while we make our lessons very interactive with the facts, we focus on making healthy choices. These kids are always surprised by the facts. The second perspective is from a school nurse. I work with many school nurses in the Spectrum Health School Health Program and many teachers and school administrators. The consensus of everyone is the behavioral changes that happen with youth that are addicted to nicotine. Irritability, restlessness, poor focus and performance, mood changes, those are all the changes that we see. Unfortunately, it leads to poor grades, poor relationship building, and increased mental health issues. The other perspective is as a parent of a former adolescent who vaped. When my daughter was a freshman, she tried vaping. The hardest thing that I had to do was not ground her for life. I've always had an open communication with my daughter, but I noticed her kind of pulling away. She was hanging out in her room more, spending more time with some new friends and even a new boyfriend. She wasn't doing as well in school, and she had that I don't care attitude. So I decided to take a different approach, and this was super hard. I did the approach. I told her I would not punish her for any drugs or alcohol she was doing if she would just talk to me and I could help her to get help. And so I was lucky enough that she did listen to me, and she did stop doing what she was doing. But she's 19 now, and I did confirm that she did stop, and she is not interested in it still, luckily. But the biggest reason that I knew that she stopped vaping was because her behavioral changes that she was demonstrating before were gone. So the bottom line is that these kids need help, and punishing them without giving them that help is only going to push them to do it more. So now I would like to go ahead and introduce Dr. Shelly Schmidt, the pulmonologist at Spectrum Health, who's also passionate about changing this vaping epidemic, and who's going to provide you with the facts that you need to know about these e-cigarettes and vape devices. Dr. Schmidt.
All right. Well, thank you so much, Shelly, and thank you for sharing that personal experience, because so important for everyone to realize that you're not alone. It doesn't make you a good or bad parent, doesn't make them a good or bad kid. This is about an industry that's doing whatever it can to addict our kids, and we need to do what we can to advocate for them and advocate for all our futures. So I'm going to go ahead and see if I can share the screen and see if that will work. Share. Okay, please let me know if I don't have that right. So as you have the Shelleys today, so I was thrilled to work with my co-conspirator Shelley Klochak up at Spectrum Gerber today, working with PAVe on e-cigarettes and youth vaping. One of my prior partners in crime, Dave Stultz, and I used to do talks throughout the middle and high schools of West Michigan back in 2019 during the sort of height of the early part of the epidemic. And PAVe was really, we were in an advocacy group that we were in awe of in terms of what they were able to accomplish. And so I'm glad to finally be able to get to know and work with them. Let me see. I can slide advance. Perfect. So today we're going to talk just briefly about PAVe and their advocacy. This continued national epidemic, big tobacco, why teens vape, their health harms, and importantly, what parents and advocates can do to help our kids. So PAVe's origin story is a bit of a legend. I had heard it probably 12th hand, but I had always talked about it in presentations, that during the epidemic, Juul, really the device of the early epidemic, had sent out education specialists in high schools. And the purpose of that was to educate students to try to keep them away from vapes. But into the high school they went and asked that administrators and teachers be removed from the room so that the children could be more candid. And then when one of the kids asked if these devices were safe, the Juul representative pulled out the Juul, used it in front of them and said they're perfectly safe. And in fact, we anticipate them to be FDA approved. And this story was regaled in the congressional halls. The mothers of PAVe were able to get their children in front of congressional members and work their way all the way up to the White House to talk about the dangers, and in collaboration with some other angry Silicon Valley parents where Juul was being designed and sold down the road, and with advocacy groups that have worked against the tobacco industry for decades, were able to do something that's never been done in this country, and that was to pass a Tobacco 21 law federally in December of 2019, a minimum age to buy of 21 for all tobacco products. Many people didn't realize that that wasn't the case. And actually in the state of Michigan, from 2015 to 2018, it was perfectly legal for children to buy Juuls because they weren't regulated in any way. And so the Tobacco 21 law was a huge accomplishment, really within almost a year of their advocacy, when this has been something that had been worked on, for decades prior. And so it goes to show that if we can get the right stories to the right people, what a difference they can make. And unfortunately, we still have more work to do. So back in 2018, the National Youth Tobacco Survey had published its findings that at that time, one in five high schoolers were actively currently vaping and 1 in 11 middle schoolers. This was such a shocking surprise that it hit the news cycle pretty ferociously at the end of 2018 and into 2019. The 2019 data was even more horrifying, with 1 in 3 high schoolers currently using, 1 in 5 middle schoolers currently using. And with the implementation of the Tobacco 21 law and the acute lung injuries that were happening around 2019, the 2020 data was looking more encouraging, but still back to the horrifying data of 2018, which again is 1 in 5 high schoolers currently using. The 2021 data is starting to look a little more encouraging, but the problem being that this is data that was taken during stay-at-home orders. It's likely going to be inaccurate. And I think the other lesson that we learned from 2020 was that while we did see a reduction in the total amount of current users, the current users were actually using more often, suggesting a worsening level of addiction in those particular students. Oh, I went backwards, sorry. In Michigan, our 2019 data is the last data that we have. At that time, current smokers want less than 5%, and current vapers were same as the rest of the nation, 1 in 5. And so as we get to the 20 and 22 landscape, what we're seeing is that over the last 2 years, when the whole rest of us have been focused pretty keenly on the COVID-19 pandemic, the e-cigarette manufacturers and big tobacco has been busy innovating. And so for the last 2 years, they've worked very hard to create devices that skirt the FDA ban that came into place within 3 months after that Tobacco 21 legislation. So they're building devices that not only skirt those regulations, but they have also are starting to sell devices with synthetic nicotine, which completely skirts the FDA regulations because it's no longer considered a tobacco product. So they've been busy innovating. And with that, what we're hearing in our schools and on the streets is that the epidemic of vaping is back in wildfire full force, and that we're anticipating that the new data from the National Youth Tobacco Survey over the next couple of years will reflect that. The sad thing is this cusper generation into Gen Z and Gen Zs were really the first opportunity since the United States was founded to have a generation of teenagers who would not have nicotine in their formative years. And by 2015, when the CDC published their Winnable Battles report, at that time, teenage smoking was down to just under 10%, which was the lowest it had ever been, from a high of 1 in 3 current smokers back in 1991. When that report was published in 2015, that's when Juul launched. And in 4 years, Juul completely erased all of the benefits that we had had from decades of work with teenage smokers, now with nicotine users back to 1 in 3 by 2019. Just a devastating blow. So what is it about our youth? You know, Juul and all who come after it are specifically looking to the youth. And it's not just because of their years, it's really because of brain development. And so their interest in the youth has to do with the fact that while their brains are still developing, it gives them an opportunity to get their product into those brains. So when we're infants, our brains have the ability to do anything we'd like. We can learn to be English speakers or Mandarin Chinese speakers. We can learn to play the violin or to ski. We really have a limitless amount of ability in an infant brain. And as the brain develops, and as you're doing something more often, for example, if you're raised in an English speaking household and you hear English and you're starting to speak English, the brain realizes that those particular pathways are being used very often, the English speaking pathways. And so it hardwires them in to make them more efficient because you use them all the time. And so that process of pruning away circuits you're not using and hardwiring circuits you are using all the time is what's happening from birth really till about age 25. And so our elementary school, middle school, and high schoolers are still in that phase. And the problem is the brain can't tell the difference between learning a foreign language or learning an instrument and a nicotine addiction. And so if the brain is repeatedly seeing nicotine, that nicotine is coming in and creating a circuit pathway of addiction through the brain over and over again, the brain is going to hardwire that circuitry in. And that's why kids are so important to big tobacco. Over 90% of nicotine addicted adults started before the age of 21. And when I see patients come in who are continuing to smoke after they've had part of their lung carved out for lung cancer, they almost always began smoking in that middle school to high school timeframe. What makes this even more difficult is the method of marketing. So it was one thing kind of back in the earlier days when we could stop Marlboro from getting onto NASCAR or pulling them off billboards. But when you're talking about social media and text messaging, this is not something that's even really regulatable or controllable in some respects because the kids are their own advertisers. So they're putting on TikTok them vaping in the classroom. They're putting their own shots on Insta of them with a huge plume. So they become their own advertisers. So all these companies have to do is feed an influencer or seed a little bit here or there, and then the internet takes it from there. And so it makes it so difficult to try to control the advertising and marketing components when you have this really free reign in social media. And once again, the book that we had almost had partially closed back in 2010, when the federal government actually banned flavored cigarettes, because at that time it was very clear that the only reason to have a cotton candy cigarette was to addict a kid. Again, 2015, when Juul hits the market, is completely erases all those gains with an unregulated flavored product, using decades of prior marketing research that was available from the tobacco companies through the tobacco settlement that's now actually commonly available in the public record. But then also Big Tobacco, of course, has invested in these companies as their future. And so being able to provide all the landscape background for the different types of research they've done on youth, what they've done for brain development, and what they've done with nicotine addiction to these companies, including how they market, marketing in party stores or in gas stations, where they're keeping the marketing at child level, at lower levels, keeping them a higher density near to schools. These are tactics that the tobacco industry has used for decades. And alarmingly, the best way to stay under the radar is for tobacco to take advantage of groups that traditionally have not had a congressional voice. And these are groups in the lower socioeconomic status and in minority groups. And tobacco has taken advantage of that in order to addict that population. And probably most glaringly, their advertising campaign starting in the late 60s to 70s, where they were aligning menthol cigarettes with blackness. And a menthol cigarette, which they couldn't sell in the white market, they had twisted with a marketing campaign to really be associated with blackness, and unfortunately creating likely a device that's even more addictive due to its less caustic nature when smoking. So why are these still available to our kids? Really, again, over these last couple of years, FDA and frankly, everyone has been so focused on COVID that although it was anticipated that Big Tobacco would shift to deal with the 2020 FDA ban of cartridge related products such as Juul, the device of the epidemic, and to ban their flavorings other than mint and menthol, which of course mint was their most popular flavor at that time. But anyway, these devices now skirt that by being disposable. So these were reused cartridges that were in the original ban. And by using synthetic nicotines, they're able to create all of these flavored products, just like thousands of flavored products. In addition with the e-liquids that completely skirt the FDA regulations and allow kids access to these devices. So for example, it almost seems quaint now when I'm talking about Juul, but Puffbar, which is a current teen favorite. So when Juul came out, one pod for Juul was about the nicotine that was in a pack of cigarettes, and that seemed kind of horrible. The entry-level Puffbar is a disposable device with 2 packs of cigarettes worth of nicotine. The Puffbar Plus is 5 packs of cigarettes worth of nicotine in one disposable device. The Puffbar Flow is 9 1/3 packs of cigarettes. It is a carton of cigarettes in one disposable device. It is completely out of hands. And these very high levels of nicotine will lead to faster addictions in our young people, for sure. It almost seems quaint now to think about Juul with what people like Puffbar are doing, but these sort of the initial devices of the epidemic, these cartridge-based devices, the issue with them is they're hackable. So they can put other liquids into each of these pods with higher nicotine concentrations or other things. And that's really one of the concerns about refillables, e-liquids, and then ultimately the mods, which we see on the right-hand side of the screen. The thing that's always the additional thing besides the nicotine addiction that's concerned me about these devices is that nicotine and alcohol, there's decades of data that these are gateway drugs, right? They lead to higher order drug use, which can be more imminently lethal. And when I was a kid, there was a chasm of difference between smoking a cigarette and waking up with a needle in your arm. I mean, they were just two different sides of the world. But when you take a device like a vape that has nicotine in it, and then you transition then to the next drug, which we saw, right? 2015 Juul launch, 70 to 80% market share by 2017. By 2019, all those acute lung injuries are what? THC with marijuana, right? So we've already transitioned to THC. And in that 2019 year, we're seeing meth, we're seeing crack cocaine, we're seeing now fentanyl. Anything you can liquefy or wax, you can put into these mods. And so now the difference between going from nicotine to a lethal opiate overdose is not a chasm anymore. It can literally be done with the same device. What's more, in addition, especially now that we're seeing synthetic nicotines, this now becomes a battle of what are we trying to do as a country and as a community in terms of creating nicotine addicted adults. And now there's a whole bunch of other products on the market, from toothpicks to gums to whatever, that are just trying to find their way into the youth with nicotine so that they can addict their brains and make a customer for life. And in addition, and a way of really normalizing this process of using vapes, now we're vaping all sorts of other stuff, melatonin and vitamins and essential oils. And I'm here to tell you, as a pulmonologist, lungs are only designed for one thing, and that is clean air. Not even polluted air, clean air. Clean air is what they're designed for. You do not need to be taking melatonin in through the respiratory tract when we have a perfectly good GI tract that we can use. And unfortunately, all of these other devices which start to normalize this concept of vaping is just going to lead to more work for me, more acute lung injuries. So how do companies like Juul and Puffbar do this, making it themselves not just more addictive, but attractive than traditional cigarettes? So for those of you on the call who've smoked, I'm sure there's a bunch of you. I went to college. This is something that many of us have done. What's the first thing that happened to you when you smoked a cigarette? The very first puff. You probably coughed. You probably did a lot of coughing. And that's because cigarettes use free-base nicotine, which is a very caustic because it's so basic in pH. And what that does, it causes a bunch of throat irritation, nose irritation, and upper respiratory tract irritation. Your lungs know better. They don't want any of that. And so they make you cough. And you really have to suppress that cough in order to get the smoke down into your lungs. So what Juul did, and companies like Juul did originally in creating nicotine salts, Puffbar uses a synthetic nicotine, which is different, but accomplishes the same task. With nicotine salts and synthetic nicotine, they're able to normalize the pH, the acid-base level of the aerosol that you're breathing in. What that means is it doesn't irritate your throat. It doesn't irritate your upper airway or your nose. So you can get very long drags off these devices with very high concentrations of nicotine. And what's scary about that is that in addition to the addictive component of nicotine, which we'll talk about in a minute, is nicotine poisoning. And so you can get seizures, you can get blackouts, you can get fast heart rates and irregular heart rates that all come from nicotine poisoning from these very high doses of nicotine you can pull off these devices, which you're just frankly not able to do with a traditional cigarette because they're so caustic. In addition to that nicotine, there's all these other harmful substances. So again, getting back to the lungs are only designed for clean air, that is it, okay? So all the rest of this stuff will cause, I'm telling you, will cause lung inflammation. And so if there's one thing that these vapes are not, they are not harmless water vapor. Every one of these chemicals will be able to cause some amount of lung inflammation. Many of them are known carcinogens. And so in addition to the flavorings, which some, yes, are USDA approved to be in food, many of them have requirements like they can't be heated because they create a gas that causes lung disease, like diacetyl. And so the issue here with this huge screen is that it's completely unregulated right now. They can put whatever they want in these devices. They can say whatever they want on the wrapper. Nobody's making sure that what they're saying on the wrapper is what's actually inside the device. And so these are chemicals that our government has identified from vapes they've taken off the market. Cadmium, cobalt, I mean, these are carcinogens in the metal casing. So from metal casings to asbestos in the wicks to having these flavorings and the nicotine, all of it harmful. So how does vaping and nicotine affect the body? And this is really where push comes to shove with the nicotine. What does nicotine do? Why do people use it? So with one puff off that cigarette, one puff off the vape, within 5 heartbeats, nicotine travels to an instinctual part of our brain that we actually share with lower mammals. That's called the ventral tegmental area. So if you picture yourself as a little early mammal, brown and fluffy in your burrow with your family and friends, this part of the brain is signaling safety. But this part of the brain also signals instinctual threat. So when you leave your burrow and you're faced with a saber-toothed tiger, this part of the brain is signaling threat, 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 threat. When nicotine comes into the body and reaches this instinctual center that tells us the difference between safety and threat, it signals safety. It signals instinctual safety. It is an incredible anxiety drug. That's why people use it, because it calms it all down. You are instinctually safe. The problem and the flip side to this area of the brain is the longer it's been since that instinctual safety signal, the more it starts to signal threat. And so the longer it's been since the last nicotine exposure, the more threat and the stronger the threat signal is. And so the anxiety, the anger, those symptoms that come with withdrawing from cigarettes is a direct relationship to the person feeling instinctual threat. They are feeling like there's a saber-toothed tiger right next to them, even though they can't see it. And they know that within 1 puff of their vape or 3 puffs of a commercial cigarette, they'll completely satiate those receptors and we're back to safety. Nicotine is the only drug of abuse that acts in this area of the brain, and 2/3 of people who try nicotine report dependence on it. It is the 3rd most addictive substance known to man after heroin and cocaine. It is not a joke. Nicotine is not caffeine. This is not a joke. And so people have to realize that these addictions, they come on and they're very strong and they're very difficult to control. And in adolescents, from the 2016 Surgeon General report on e-cigarettes and adolescents, adolescent brain is highly susceptible to nicotine and highly susceptible to addiction. Nicotine causes permanent cognitive changes in the developing brain, and including causing worsening attention, worsening memory, process speed, impulse control. These students are more likely to have additional risk-taking behaviors and have more trouble with the law than their non-addicted peers. They're also more likely to reach a lower socioeconomic status than their non-addicted peers. And what's more, these students are using nicotine to calm the anxiety of being a teenager. But what it actually does is hardwire in a worsening anxiety disorder. And so it's very difficult to get a truly nicotine addicted person off these devices without using a medicine to treat their anxiety. In addition to what it's doing in the brain, obviously being pulmonologist, my concern, in addition to that, and what's happening to our children, are the lungs. And as I mentioned, lungs they're just designed for clean air. That's really it. Everything else that comes in there, there's going to be some study, just give it a minute, that's going to show irritation, inflammation. That's just what happens. And so it's important for us to try to move away even from these vapes that are, like melatonin and vitamins and everything else. These are going to be bad for lungs. In addition to causing worsening asthma, we see athletes having more difficulty doing their athletic pursuits because they're getting more short of breath. cough. Nicotine in and of itself is also an immune suppressant, so it makes it difficult for the immune system in the lung to identify and fight pathogens, so it makes respiratory infections more likely. And as you saw in late 2019, the emergence of all the acute lung injuries related to the chemicals in the vapes. Although nicotine signals instinctual safety in the brain, it's actually a stimulant to the cardiovascular system. So it restricts blood flow and increases blood pressure, adrenaline, and heart rate. And that's what makes it a risk for cardiovascular disease. Nicotine independently a risk for cardiovascular disease, separated from cigarette smoke. Additional risks include, we talked about the weakened immune system and the nicotine poisonings, which have been on the rise since Juul hit the market. And so these include blacking out, seizures. We had a car accident here in Grand Rapids of a young girl who seized with too much nicotine, in addition to heart palpitations, difficulty exercising, GI issues, and then the mental health aspects as well. As you may remember, in late 2019, we started reporting e-cigarette or vaping associated lung injuries here in the state of Michigan. Down at Henry Ford, they did a double lung transplant, you may remember, for a young man who had a vaping associated lung injury. And so the CDC did close that reporting in February of 2020 with the advent of the COVID pandemic. So we actually have no idea how often this is happening. I'll tell you that in our hospital, we were typically seeing about 1 case a month of a young person coming into the intensive care unit and requiring a ventilator or requiring high dose oxygen because of vaping. So it is clearly still a thing. We just don't have an idea of how often it happens. And it also happens in non-THC vapes. It's important to realize that. Because of the effects that vaping and nicotine have on the immune system, young people who vape were 5 times more likely to get COVID-19 than their non-vaping peers, and they were 5 times more likely to get symptoms from their COVID-19 than their non-vaping peers. And next, I'm going to hand it off to my cohort, Shelley, to talk about, take us through to the end of this, and I'll keep advancing slides for her.
All right. So now we're going to talk about the reasons that teens vape. So we went over the youth targeted marketing campaigns, the affordability of these products, the accessibility of these products, and how these flavors entice these teens. But let's talk a minute about menthol. Menthol makes it easier to use these products by cooling and numbing the throat. Most kids who start vaping start with flavored products. 85% of high schoolers use flavors. Data shows 37% of the flavored products also have menthol in them, but we are confident that this is higher because many of the flavored products include menthol along with the fruit or other flavor. They're typically called iced, so they have that extra cooling effect with the flavor. So like iced mango, iced blue raspberry, they may not be reported as a menthol product. Calling a flavor iced is simply a sneaky way for companies to avoid using the word menthol. Next slide. So when kids hear safer than cigarettes, all they hear is safe. And there's just no safe nicotine product for kids. Juul and other e-cigarettes are actually less expensive than cigarettes, and so that makes it enticing. We hear from medical experts that there is always a connection between substance use and mental health. So often kids will use drugs like nicotine to self-medicate if they have an underlying mental health issue, like anxiety or depression. Because of the new form of nicotine that Dr. Schmidt talked about with the nicotine salts and the synthetic nicotine in these e-cigarettes, kids can have, they have a stronger head rush within seconds. And so that makes it very alluring and addictive to kids. These products have been very accessible to teens, and even though it's illegal to sell these products to teens or anyone under 21, they are being sold at convenience stores, gas stations, smoke and vape shops, and with very little difficulty. And so while some shops do ask for IDs, there are many that don't. Next slide. So look at this picture here. We want you to know what to look for. The devices don't necessarily look like anything bad. They look like pens, highlighters, USBs, and even the liquids are in bottles that look like small household products. See if you can find any of the e-cigarettes in this. As you were looking, now we show you with the highlighted areas. It's really easy to hide these products right under the noses of parents, teachers, and any other adults. So these are some examples of both disposable and non-disposable vapes. But there's also vapeware out there, which is clothing that's created to house vapes to smoke in plain sight. So there's sweatshirts with strings on them that they can vape right out of the string. There's backpacks with the same kind of concept. There's like little ports that they put on their phones that you can't even tell. There's watches and it's right on their watch. So it's really, they really make it easy. Next slide. So we want to look over 10 signs here for you guys to look out for teen vaping. The first one, secretive attitude, closed doors, frequent excuses to use the restroom or go outside, any kind of sweet smells in the air, or even just using candles or room fresheners more often to disguise smells. Dry mouth is really common because the propylene glycol they use in these products dry up the nose, the throat, and the mouth. So they may want to drink more. They have cravings of salt, even nosebleeds or mouth sores. So those are some things to look for. And then look for unusual, colorful plastic cups, USB drives, like those highlighters and pens that you've seen in the picture, things like that you want to just watch out for. Changes in sleeping patterns, the raspy cough, more lung infections, chest pain, shortness of breath, pneumonia, the heightened caffeine sensitivity, jitterness is a real big one. And then that anxiety I talked about earlier, irritability, mood swings, and anger. When you see some different changes in your youth, you wanna think about it and just start talking to them. Changes in eating habits, nausea, because that can be associated with nicotine. And then spending is something you guys want to keep an eye on spending. So especially if they have a Venmo or a debit or some kind of card that they use, you want to keep an eye on that. It's quite easy to buy online. So you even want to look at packages, and they're covering these packages up. So they look like just some random thing, and they may have e-cigarette supplies in them. And delivery drivers are supposed to ask for IDs when they deliver these kind of products because they're supposed to be over 21, and they don't. Many don't. So it's really easy for teens to get these products anywhere. All right, so how do I talk to my kid? First, you have to prep the conversation. So you want to come from a place of understanding and support. Remember that these kids were targeted, so they may not think that the vaping is harmful because it seems normal, or the myths that are out there that are believed. Do your homework so that you understand these health effects, concerns. This is part of your homework. You guys that are attending is awesome because you're learning what these health effects are, but you need to know that going in when you talk to your kid. And then finding the right time. So starting early always helps because some kids are actually starting in elementary school. In Newaygo County alone, the average age to start any kind of tobacco product is 11 years old. And I know that around our state and around our country, we're finding these are mimicked across. So these kids are using young. You may use situations like to kind of start the conversation. If you see a commercial or you see somebody doing it on TV, it can just it can be an opener. A YouTube, that's another one, big popular one. That you can start a conversation that way. There's not a one-time conversation. It's a continuous conversation that you need to be having with your kids. Be considerate of their privacy, but at the same time, we have to look at them too. We do have to look in their rooms. We do have to we do have to ask them to talk to us, and that's really a hard one right there, because trying to maintain that privacy while we're trying to get to the bottom of it at the same time, it's a struggle. So what approach can we use? There's no single approach that's going to work. You know your kid, your relationship best, and so and sometimes we learn from others. So you know, talking to others and finding out how they do it can help. Just listening to this can give you ideas. I just can't stress enough though to strive about keeping that communication open, talking rather than lecturing to them, because as soon as you do that, the door goes up. They're not going to listen to you. Asking questions about their experiences, their understanding of the products. Scare tactics and exaggeration are only going to make your credibility no good. The facts themselves are scary enough. So just using the facts themselves is going to work. So what else can you do? So talk, listen to your child, be their advocate. You want to model behavior. You don't smoke or vape. Parents' behavior is a predictor of a child's behavior. And I say that without any judgment or shaming, but it is a fact. Encouraging those conversations with any other trusted adult. If they, saying, if you're not comfortable talking to me, would you talk to your aunt, or would you talk to your your counselor at school, just some other one that you would trust, trying to get them to talk to a trusted adult. Talking with your pediatrician, about ways to help. You want to approach it with that no shame, no blame attitude, because otherwise, kids are going to be closed off. Our kids were fooled into thinking that these products were safe for them. So we need to help them in order to avoid using them or to quit using them. There is a page that does have a private online support group on Facebook, and that's a really nice support for you guys and to really help you with talking to your kids. So support that's out there for your kids. There is a ton of support. So not only your pediatrician, or maybe you have a local tobacco treatment specialist like I am myself and my partner here in Nuevo County, but there are many tools out there. You can talk to your doctor about medications, counseling. I want you to know that relapse is normal. So sometimes we have to be patient. It takes some people many attempts to quit nicotine. So we do have to be patient with them. But if your child is dependent on nicotine, quitting is very tough, but there are the resources that are specific to youth. And those are the ones listed here. The Truth Initiative, This Is Quitting, the smokefree.gov, and there's another one for Michigan that's called My Life, My Quit. Those three I highly recommend that parents use. And I, push for school administrators and teachers to really use those resources as well for their students. They are evidence-based programs to specifically help teens quit, and they can use texting, computer, phone, whatever way the teen wants to, and it's anonymous. Is another very nice benefit, and to try to get youth to use it. PAVe's website does have a list of these quit support groups on them at parentsagainstVaping.org. Now, there are school-based curriculum out there. Here's two evidence-based ones that are listed here for any schools interested in using curriculum for their students. And there are more resources for schools on the PAVe website for like best practice administration policies. But I wanted to talk about a question that came up in the chat earlier about what curriculum I use when I go into schools. So I pull actually from, we use all evidence-based education resources. And so we use those, the Truth Initiative has a program. There's all different, the Catch My Breath, you know, even those, there's Stanford actually that's listed here. I love part of theirs. So what we do is we pulled off from a few of these different evidence-based curriculums to pull together our curriculum, and we have one that's specific more for like fourth grade level, fourth grade level. We have one for middle school level and then high school. So you know, and then we also use based on the Michigan curriculum guidelines as well. All right, next slide. So this is PAVe's new youth targeted campaign about the environmental and human impacts of tobacco industry and e-cigarettes. I encourage everyone to check this out. We really have to think about our environment because these products, you know, are not good for our environment. Just, you know, a small amount, less than like a third of a teaspoon of the e-cigarette liquid can kill an infant child. So, you know, this is poison that's in these devices. It's batteries in these devices. And so having that out in the environment is definitely not good. So check that out. The next slide here, have this, I always forget what these things are called.
QR code.
QR code, yes. So if you use your phone and use that QR code, you guys can go right into the PAVe site and get in touch with PAVe. They like your feedback on today's presentation, which helps to improve work all around the country in the future. So go ahead and use that if you wish.
And then, you know, I think one of the important things about the advocacy piece is that, you know, every month and year we delay on creating regulation around this industry is just thousands and thousands of more kids getting addicted. And so time is really of the essence here, and working together as a group of concerned parents and educators and physicians and nurses to really try to continue to bring this up. I know we're all swamped with COVID, but you know, every month we wait, there are more kids who are getting addicted to these devices, and it's just it's so frightening. And we really appreciate any effort that any of our participants are doing now and continuing to do in the future to try to help stem this epidemic.
Yes, absolutely. We need you guys' help, whether it's other healthcare people, whether it's parents, anybody. You know, legislators listen to parents, and so we really, really need your help, you parents. On the next slide, it shows PAVe's website, and you can use that to get in touch with PAVe, ask questions. They also do allow any donations. They are run by unpaid volunteers, and so they do welcome any and all donations that you may have. But we want to thank you today for listening to us. And now we're happy to take any questions that you guys might have. You're welcome to put it in the chat, or if you want to go ahead and take your speaker off, that's also.
I'll just, there was a comment in the Q&A about nicotine replacement therapy. This is a really tricky spot because, as you noted, it's not FDA approved for under the age of 18. And so this would be another important area of advocacy to your legislators about not only allowing for strict regulation against these devices, recommending stronger enforcement, because that's a whole nother battle, right? So they're not really enforcing the laws that are in place, but also to allow emergency use authorization for NRT for teenagers, because we were talking about this beforehand. Nobody gave Juul or any of these companies FDA approval to get my kids nicotine addicted. Why do I need FDA approval to get them out of it? And so yeah, I think that's trying to find pediatricians to work with you, and then and if the schools are having issues with I can't imagine they would have issues with patches and things like that. But if they are, I think that's certainly something that requires some more advocacy too. The thing is that when we meet parents, they're like one of two vibes. It's either not my kid, or they feel like really embarrassed that it's their kid. And so, again, this is not about how good or bad a kid you have or how good or bad a parent you are. This is completely separate. But the people who think it's not their kid, I'm telling you, statistically, it's probably your kid. And so the point being is that there are tons of other parents who are embarrassed to bring this up, who are dealing with the same thing in their households right now in your school district. And bringing those parents together and bringing them together in front of the school district to say, you have to stop penalizing our kids. You can't be, if they're trying to do nicotine replacement therapy, kicking them off a sports team is not going to be helpful. Like, we need to support these kids, and we need to support them in a group environment, because they are going to do this together, right? It's going to be really hard for one kid to do it if the rest of his group that he hangs out with, the other 7 or 8, are all doing it too. So it's, how do we support them in groups so that they can get past these addictions and teach them those skills of how to do it, instead of just teaching them the punishment, which is not going to help them as a life learning exercise. And so I think finding your people, they are there in your school district, finding your people and coming together to talk to your administrators about this, I think would be super important. And PAVe, I'm sure, can help with that as well.
Mm-hmm. It looks like the other question was the proven quit resources for teens. I talked about those with the Truth Initiative, smokefree.gov, and the My Life, My Quit. And those are great programs.
And those have been studied, so they do statistically help quit. But again, there's not going to be statistical data on nicotine replacement therapy, because they're not approved for kids under 18. So people aren't going to get studies funded for that.
Yeah.
I'll take a moment just to plug while we're here. I have to say first, thank you so much, Shelly and Shelly. That was such an excellent presentation, and your expertise is so wonderful. I hope people have gotten a lot out of this, but I just wanted to mention that our Clear the Vapor conference, which is virtual, our second time ever, is happening in May on the 24th and 25th. It's totally virtual. It's totally free. And I plugged the link into the chat, parentsagainstavaping.org/conference. You can pre-register right now, but it's open to clinicians, teachers, school administrators, public health professionals, parents. We really try to make it very accessible. We cover a ton of topics over 2 days. I'd encourage anybody that's interested in more on this topic to join the conference. Thanks.
So I just want, thank you so much, Christine. I was just going to comment real quick on Vicky's last question about the e-liquids not containing nicotine. So the issue is that, again, none of this is controlled in any way. So you have no idea what is in that device. And there have been studies, academic studies, that have shown, that have found nicotine in devices that say they do not contain nicotine. Because what is the point of the device if it is not to hook your kid? And so you have to remember too that these devices are coming overseas. There's a bunch of counterfeit devices that are coming in. So not only are the American devices unregulated, but there's no reason to suspect anything that's coming overseas would not include nicotine or other addictive chemicals. That's like the whole point of why they're selling it. And so while we will not know what's in any individual vape, but I will tell you that when I said that about once a month we have a kid come in who's got a lung injury into the hospital, I'll tell you almost uniformly, it's quote unquote, but my buddy made this for me, but the local vape shop made this for me. They told me that this stuff was clean. They told me it was fine. And the problem is, none of what they've come up with can they safely put into a lung. and know with 100% certainty that you're not going to cause a lung injury. So sometimes you can get away with it, but sometimes isn't all the time. And you don't know when it's going to be your break that lands you in the ICU. And so I do have parents come up and ask me, what about just having my kids kind of like vape water so they're like every other kid, and then it kind of comes down to, okay, so part of the issue is you still have the metals, you still have the wicking, you still have the battery, you still have all those other chemicals that are in there. And so it does become a broader conversation about, if we are modeling for kids that it's okay to treat stress with substance, then you're just now arguing about what substance. You do alcohol, I do my vape, whatever. The key is that there are dozens upon dozens of other ways for kids to be modeled to do a healthy method to manage stress. Stress will be there their whole entire life. The key is, how can we teach them to manage that without it being about substance? And that is a broad societal problem that we have, but it's one that really meets at all of our kitchen tables, is really treating stress with stress reducing activities that don't include substance is really the key, and modeling those for our kids. So thank you so much. And thank you to PAVe for the invitation. So it was so great. It's so great to interact with you and your amazing organization. And I hope we can just continue to kind of spearhead. Sadly, we're back at it again, but hopefully we can continue to spearhead some additional regulation to protect our kids.
Thank you.
Yeah, thank you, everyone.